Hello and welcome to another Healthy Bite. I'd like to acknowledge the traditional custodians of the land on which I am recording this podcast, the Gadigal people of the Eora Nation, and pay my respects to their elders, past, present and emerging. Well, this week we explored sleep again, and I had the absolute pleasure of talking with sleep physician Dr. Dave McCarty, whose website and book is called Empowered Sleep Apnea. And Dave is a passionate, patient-centered practitioner, totally devoted to his patients, takes them on a very interesting journey, which if you follow the podcast, the interview, or visit his website, you'll understand exactly what I'm talking about. And also, he happens to be a very passionate cartoonist as well, and he brings that work into his website and his book. So it's he's just the most wonderful guy, and I really enjoyed meeting him, and I'm looking forward to working with him in the future. It highlighted again sleep, and sleep is such a big and important topic. It's worth revisiting. It's worth reminding ourselves of how important it is. You know, one of the things about seeing patients on a regular 6-monthly basis like we do is that it's an opportunity to reconnect with people and ask them some 3 or 4 very basic questions. And I'll ask you these as well. Is it easy for you to fall asleep at night? Yes or no? Do you wake up through the night? Do you need to go to the bathroom? That's all one question. The third question is, do you wake up with a headache? And the fourth question, probably the most important question, is do you wake up feeling refreshed? Well, let's come back to the first question. Is it easy for you to fall asleep at night? Ideally, you should be falling asleep within about 15 or 20 minutes. And of course, there are times in our lives when that just doesn't happen, but we're talking about in general, in the majority of the time, is that the case? Because insomnia, or the inability to fall asleep, is a common diagnosis that people get when they present in a doctor's surgery with poor sleep quality. They're tired, excessive tiredness, lack of energy, anxiety, irritability, difficulties with tasks, learning and remembering. But it's worth remembering that chronic insomnia, is defined as occurring when at least 3 nights a week for 3 months on end, you have trouble getting to sleep. Or I should say, there are 3 different types of sleep apnea. One is difficulty falling asleep. The other is waking up and having difficulty returning to sleep. And the other one is just difficulty staying asleep. So you'll keep waking up. Now, it's suggested that women and older adults are more susceptible, but insomnia affects, according to the statistics in America, 40 million Americans. So insomnia is an interesting one because it is really, when one looks at that first question, is it easy for you to fall asleep? That's a real question about sleep hygiene, about how you prepare yourself. And I'm often asked, what are some of the things you do to stay healthy in a day? And I always say, well, the first thing is I go to bed at a reasonable time the night before, because in order to prepare my day, I need to be in bed and get enough sleep, because we need 7 to 9 hours sleep a night for over 90% of us. But getting to sleep is the issue here. Is it easy for you to fall asleep? There's a really interesting, not everybody's the same. I think that's important as well. I mean, for me, my ideal sleep time is probably around 9:30, 10 o'clock. And there's a wonderful online quiz you can do called Auto Morning Evening Quiz. You can do this online and answer a few questions, and it will give you what is probably your ideal, or give you an idea of when you're best suited to go to sleep. Now, if, for example, my ideal time is 10 o'clock, then I need to start looking at my sleep hygiene, because remember, we're focusing on, is it easy for you to go to sleep at night? And so my sleep hygiene means, okay, if I should be in bed by 10 o'clock, I set a mental alarm for 9 o'clock, an hour before, to start toning things down, to dimming lights in the house, to stop watching TV, to not have technology around me, either at my bedside. I don't look at my laptop or my iPad or my phone in bed. The light from these devices has a negative impact on the melatonin and the switching on of that which puts you to sleep. So that's important, starting to tone down. But I go back even further in the day, and that is, when have I eaten? I don't want to eat just before I go to bed. I certainly don't want to eat a heavy meal. And drinking alcohol. I mean, alcohol might make it easier for you to go to sleep, but it most certainly does not ensure that you get a good night's sleep. In fact, quite the opposite. You don't get into the deeper levels of sleep because of the alcohol. Caffeine is another one. I stopped drinking caffeine. I do have 1 or 2 coffees a day. I will not have a coffee after 1 o'clock in the afternoon. I try to also get out in the sun, because while blue light from devices like computers, laptops, and phones is bad for my health, bad for my melatonin levels, getting out in the sun, particularly early in the morning without sunglasses on, and allowing the light to get into my eyes and, if possible, to get onto my skin, is also really important in preparing for that night's sleep. If I can include some exercise, particularly in the early part of the day, I think that improves sleep quality as well. So there are many things that you can do about making it easier to go to sleep. Then we look at the environment in which you are sleeping. Is it the right temperature? The ideal temperature is cooler. It should be around 18 degrees centigrade, which I guess is, I have to go back into the old currency, somewhere like 70 degrees Fahrenheit, or high 60s, low 70 degrees Fahrenheit. But around 18 degrees is a good temperature. Is it dark in the room? If there's light coming into the room, if you've got a digital clock right by your bed shining light into you, that's not a good thing either. So the room should be dark. It should be quiet. And by quiet, I mean as quiet as you can. Well, that's often not in your control because of you might be near a busy road, or you might be have noisy neighbours. And I think that is something to factor in to decisions that we make in our lives. I think there are some serious implications about that. And having a road near you that is noisy, raises issues about your sleep, but there's also environmental stressors involved there as well. Is your partner, the person sleeping next to you, keeping you awake? We've spoken about this on many occasions, but a partner that snores, this is not a social problem. This is a serious physiological problem. If you are fortunate enough to share a bed with someone who you care about, dare I say, love, and you are concerned for their health, then you should take your snoring seriously, not just for their benefit, but for yours as well. Because if you are snoring, it means you have a restricted airway, and you are not getting as good a night's sleep as you should be getting as the snorer. But the snoree, your partner who has to listen to this snoring, is getting a bad night's sleep as well. So noise is another one, and electronic noise is another thing to think about. Checking in with the world, checking your Facebook and your emails, connecting with the world just before you go to bed is not the time to do that. This is no time to connect with the world. It's the time to connect with your pillow. And so you should be doing things which are conducive to making you tired. Personally, if I keep a lot of books that I read for professional interest on my Kindle, because I love to highlight and share quotes and store them for later use. But I have a problem with that for 2 reasons. One, it usually stimulates me too much and makes me think about work when I shouldn't be. The light from it, yes, I've got filters. I could use blue blocker lights, but that's not a good thing either. I find personally that history is very soporific. I love reading history, and I love reading it just before I go to bed because, firstly, I find it interesting, and secondly, I find it makes me tired. And after 3 or 4 pages, I'm usually ready for a sleep if I'm reading things like that. So think about things like that. So the first question, is it easy for you to fall asleep, is a really important one. The second question, do you wake up through the night? Look, lots of people wake up, roll over and go back to sleep. And if you recorded it, it probably wouldn't last for more than 5, 10, 15 seconds. But if you are consistently getting up at night to go to the bathroom, and there are many reasons why that might be, medications, prostate, diabetes, a whole range of issues, but commonly what causes people to wake up at night to go to the bathroom is a disordered breathing while they are asleep. And to any regular listener of this podcast, you will know that I have recommended, and I have in my own practice for many years, recommended the use of micropore tape on the mouth at night. And the way I suggest that should be done to my patients is when I pointed out how to do it, which means you take a thin piece of micropore tape with a little tab on it so that it's easy to find on your face if you want to remove it. And in the morning, you never rip it off. You always poke and peel gently. And when I put the tape on at night, I lie on my back initially, and for 4 or 5 breaths, I breathe in slowly through my nose, gently. I breathe out slower through my nose, so my exhale is longer than my inhale. And then I might hold my breath for 3 or 4 or 5 seconds. And I repeat that 4 or 5 times. That is a great way to switch on that part of your nervous system, which is called the parasympathetic nervous system, and the rest and digest part of the nervous system. So the fight or flight, or the sympathetic nervous system, is often active in our modern world, but this breathing technique of slowly in, slower out, and a breath hold for a few seconds, repeating that 5, maybe 10 times, within 1 or 2 minutes, you've switched on the parasympathetic. A great time to do that just before you go to bed. And I'm doing that on my back, and then I roll over and go on my side with tape on my mouth. Now, what that does is I love multitasking, so I'm performing a meditative breathing exercise while I'm asleep. How cool is that? But what it also does, it helps balance out body chemistry. It helps balance out, and as you balance out body chemistry, that has an effect on smooth muscle. As you breathe through your nose, you also produce nitric oxide, which is a very important body regulator. And that has an extremely positive effect on smooth muscle throughout your body, and your bladder is smooth muscle. So when young children are wetting their beds, this is called enuresis. Often that is a reflection of sleep disordered breathing. But as adults, we don't tend to wet our bed, but we get up to go to the bathroom. But the reason for both of those things is very similar, and that in many instances is a reflection of sleep disordered breathing. So that is about waking up at night to go to the bathroom as a reflection of disordered breathing. And difficulty in getting back to sleep is also perhaps a reflection of that. Looking at the environment, looking at what stimulated you before you go to bed, looking at your exposure to natural light during the day. These are all factors which can impact on your ability, on your sleep cycle, on your circadian rhythm. Now, the fourth question, do you wake up in the morning with a headache, is an important one, because if you do, that generally indicates one of 2 things to me. Either your sleeping posture, you're sleeping on your stomach, and that puts a twist on the muscles around the neck and attaching to the shoulder, and that will cause headaches across the forehead and across the temples and the back of the head. So sleeping position is one, but another common problem is that you clench or grind your teeth. Now, why is that important? Because if you add it up in a 24-hour period, how often teeth should touch, it would add up to 15 to 30 minutes a day. And when I clench my jaw, as I'm doing now, not only do the muscles in my face and jaw tighten, but my head doesn't move when I clench and grind my teeth. Why? Because the muscles at the back of the neck and shoulder support the head to keep it steady while this tension in the jaw is going on. Well, that's what happens when we eat, and that's why our head doesn't bob around when we're chewing. Whereas our neck and shoulder muscles stabilize our head when we're chewing. And if we're only doing that for 15 to 30 minutes a day, there's no big deal about that. But if you clench or grind your teeth, you could be doing that for an hour or 2 or 3 or 4. And that fatigues the muscles at the back of the neck, which then will refer pain into your forehead, temples, or the back of your head. And that is often the cause of headaches. So that happens so often in our practice where people who have never had that explained to them, and that is important, and there are lots of things we can do about that. Specifically, we can use micropore tape on the mouth, because we know now that clenching or grinding is often a reflection of sleep-disordered breathing. If you'd asked me that question 30 years ago, I would have said clenching or grinding is a reflection of stress, nutritional deficiency, say you're not getting enough magnesium, or whatever, stress, nutritional deficiency, or pain. But now we know that in 70 or 80% of cases, clenching or grinding is associated with sleep-disordered breathing. So the use of micropore tape on the mouth may be a simple way of trialing that and seeing if that makes a difference. That could help. It could help you get a better night's sleep, but if you still have a headache, then you need to consult with a dentist who understands temporomandibular joint dysfunction, that is the jaw joint dysfunction, and how to make an appropriately fitting orthotic to fit in the mouth. Now, many people come in and say, oh yeah, I clench and grind my teeth and my dentist made me a splint. Not all splints are the same. And a lot of dentists don't understand this either. A lot of dentists think all I need to do is put a piece of plastic either on the top or the bottom jaw and that's it. Well, any piece of plastic will protect the teeth from wear. That is true. But there is so much more you can do with a properly adjusted, appropriately designed and appropriately adjusted night guard. And to a lay person and to many health professionals, including dentists, they all look the same. But in our own practice, I would use at least 10 different designs of what to an ordinary person would look exactly the same. It's not. So are you waking up in the morning with a headache? We've talked about that. The last one, perhaps the most important, is do you wake up feeling refreshed? Because ultimately, that's what sleep is about. Rebooting, regenerating, rebuilding, mentally and physically important. And we've talked about what defines a consistently good night's sleep, and that is a question of quantity, getting for over 90% of the population, that means getting 7 to 9 hours of sleep, but putting your head on the pillow is not enough, and that involves breathing well while you're asleep. And that was the subject of many of our podcasts, and specifically in our discussion with Dr. Dave McCarty this week, where we talked about empowered sleep apnea. And Dave took us on a journey which it understands the complexities of this sleep-disordered breathing condition. And it's so much more than just giving you a face mask called a CPAP or a splint called a mandibular advancement splint. So I thought this week's episode was a great discussion. I so enjoyed talking to Dave. I thought it was worth reviewing some of those sleep-disordered breathing conditions. And if you haven't visited, obviously I thought I would just share with you what I often share with my patients when they come in for their regular checkup, and that is to do a check on their sleep. Something that I think we need to be constantly reminded of, the importance of what a good night's sleep is and what breathing well is as well. I hope this finds you well. Until next time, this is Dr. Ron Ehrlich. Be well. This podcast provides general information and discussion about medicine, health, and related subjects. The content is not intended and should not be construed as medical advice or as a substitute for care by a qualified medical practitioner. If you or any other person has a medical concern, he or she should consult with an appropriately qualified medical practitioner. Guests who speak in this podcast express their own opinions, experiences, and conclusions.